Hello, everyone. This is Dr. Mubin Syed, your Daisy Doc, doing an expert spotlight as part of South Asian Heritage Month. Today, we will be interviewing Dr. Paul Kolodzik, who has written a book called The Glucose Monitor Revolution about people who are not diabetics can use them to eat right and be healthier. And he's also the founding member of the Society for Metabolic Health Physicians. I hope I got that right.
Got it right.
Okay, cool. So, Paul, it's great to have you. Thank you for being, on our show. I shouldn't say show; it's really an interview. What's your background?
So, first of all, thank you for having me. I
Oh,
very
sure.
much appreciate the opportunity to talk about a subject that I love in clinical medicine. Um, so, my background is as an emergency physician.
Yeah,
And I've spent 25 years in the emergency department and, have obviously seen a lot there and cared for a number of patients.
yeah.
But out of that experience, I see what, I think a lot of clinicians see in the US these days, and that is, um, a lot of disease that could be prevented.
Hmm.
And that includes here in the United States, it includes primarily overweight individuals and individuals that have blood glucose problems, because those are kind of the common denominators to a lot of disease because of the blood vessel inflammation that occurs in association with those problems. And so with that background, I kind of decided to move from being reactive to proactive in terms of trying to help people prevent those diseases rather than responding to them in the emergency department when people are in crises.
Got it. So, is this part of what led you to write this book then?
Absolutely. So the background is that when I decided to, try and impact people's lives in a preventative manner,
Hmm.
I became more and more educated in metabolic health, went out actually and got board certified in preventative medicine,
Yep.
and opened a metabolic health practice about 6 years ago.
Hmm.
One of the very useful tools as part of that practice is helping people assess their level of insulin resistance and their blood glucose patterns. And so CGMs became a very good tool that I use really with every patient on a continued basis now as well.
Okay. Well, let's so you just mentioned CGMs. Kind of explain to our audience what a CGM is.
So CGM is a continuous glucose monitor, and these are the devices that you see on the back of diabetics arms
Mm.
primarily, because their original use, and they've been around about 15 years, was to help diabetics assess their blood glucose level related to the administration of insulin. And so the CGMs give you a 24/7 blood glucose reading in real time, essentially. But I feel very strongly that these devices are of great value, not only to diabetics on insulin, but to individuals that want to improve their metabolic health or potentially could have insulin resistance, which we can talk about, or blood glucose issues. And
Okay.
so I use them commonly in my practice, really, as a diagnostic tool initially for patients when I first begin to treat them, and then they can be used therapeutically to help guide low carb diets subsequently.
Yeah. Okay. And so I mean they must be pretty accurate. Do they actually have to go through the skin, don't they? Um,
Yeah, so yeah, when you place these, it's really painless. The patients put this on their arm
mhm.
at home without any difficulty. And it puts a tiny filament under the skin that has sensors in it. It's really the size of a couple hairs.
Mhm.
And that filament stays under the skin and what we call the subcutaneous tissue. And that subcutaneous tissue has a blood glucose level that reflects the blood glucose levels in the small blood vessels, the capillaries that are nearby. And so
Mhm.
you get an indirect reading of blood glucose again 24/7. This device then is then the sensor that is on the arm is then linked to a smartphone app. So just by waving the phone using near frequency communication, you can get your blood glucose really whenever you want. And the accuracy is within about 8% of actual blood glucose. So it's really fairly accurate. And you can follow what we term your blood glucose curves all day long. And you can
Yeah.
see how every food you eat will impact then what's going on with your blood glucose.
So is that how it can guide your diet? Is that, I mean, how does that allow you to have that? Tell us about how that would guide your diet.
Yeah, well, first of all, I use this. Let me talk about diagnostically how we use them initially. So patients come in and we do an assessment of their level of insulin resistance, doing a fasting insulin level, which maybe we can talk a little bit about later, which most docs don't do. And
Mhm.
I feel quite honestly is one of the most important tests that could be done for most people.
Yeah. And by
We
the way,
have
we
this
can
great,
talk about that. We can talk about fasting insulin and, insulin
yeah. Well,
resistance also.
yeah, but we assess people's insulin resistance. We'll come back to that. And then we put a CGM on their arm. And I have a lot of patients, a lot of patients' focus is weight loss. Some of them it's just health. And
Hmm.
I'm at risk. I have diabetes in my family. I'm at risk for diabetes. And we put a CGM on people's arms. And for the first 2 weeks, I tell them, don't worry about what you eat. I don't want you to change your diet. I just kind of want to see where you live in
Hmm.
terms of what's happening with your blood glucose. And some patients, a minority of patients have, little insulin resistance and, their curves might not look too bad, but the vast majority of patients spike blood sugars into a much higher range than they would have expected.
Huh.
And that really helps us in terms of assessing their level of insulin resistance and then what the next steps are in terms of guiding their diet so they can avoid progressing to prediabetes or diabetes. And I got to tell you, Mubin, I have some patients come in and they just want to lose a few pounds, but we put a CGM on their arm and they find out that they're diabetic. In fact,
Huh.
they're spiking blood sugars into the 220 range. And
Yeah.
so it's a wake up call for people to see those patterns. I mean, you have used one yourself.
Yeah.
So,
Yeah. That's
yeah.
that's true. I was going to ask you, you know, if you have one of those. And by the way, this was a big surprise to me. 20% of the US population, or 20% of diabetics, I should say, in the US actually don't know that they're diabetic. And this may be one of the earliest ways you can find out if because you may be asymptomatic. And
Right.
I was going to ask you, if you have one of these, how would you know that you're diabetic? I mean, what are some of the abnormal ranges that you're seeing in
So,
people?
yeah. So this is interesting. I'm going to draw an analogy here. With pregnant women, they'll sometimes get a test called a glucose tolerance test, where
Hmm.
they're asked to drink a sugary fluid and then their blood sugar is followed over the next 3 hours or so. A continuous glucose monitor allows you really to have that test every day, all day long, because when you eat a certain load of carbohydrate, you can see exactly what happens with your blood sugar.
Yeah.
So the normal cutoffs using a glucose tolerance test are is if you have a blood sugar that spikes over 160 or so, that means you're in the pre-diabetic range.
Hmm.
And if you have a blood sugar that spikes over 220 or so, that means you're actually in the diabetic range.
Okay.
And so these, this is in addition to the standard test of a fasting blood glucose and what might be a hemoglobin A1C level
Hmm.
that your doctor might do. This is really another tool that really gives you a more precise measurement of what's going on with you metabolically.
Okay. Um, so basically you kind of started talking about this in terms of the thresholds for being diabetic versus pre-diabetic. How does metabolic syndrome fit into this, would you say? How is, I mean, because
So,
people talk
so
about all
meta,
these three terms.
Right. So metabolic syndrome is the syndrome of being overweight, having a large waist girth,
Hmm.
being hypertensive, and also having some abnormality of lipid metabolism. And you don't need to have all three of those. You can have, one or more of those.
Hmm.
Um, you mentioned that 20% of people in the US that are diabetic don't know they're diabetic. Actually, the number for pre-diabetes is now up to 40%. And I think this is
Wow.
remarkable. 40% of people that are pre-diabetic don't know they're pre-diabetic.
Hmm.
And I'm going to digress a little bit here as to why that's the case. And I believe that the US healthcare system isn't set up any longer really to help people discover these issues early on and manage them. And you and I are old enough, I think, to remember an era when docs got out of their residency and and sometimes they just hung out a shingle or joined a small group.
Yeah.
Unfortunately, they were basically small business people.
Hmm.
But basically now most docs work for health systems or even large corporations, some of them even public companies, and they're very regimented. They don't like I got a lot of friends that are carriers. They don't like this either, but they get 20 minutes with a patient at a time. So they come in, patient comes in once or twice a year. Maybe they had some lab work done. Maybe their blood sugar is a little bit high. Let's say, using the
Hmm.
standard of 100 milligrams per deciliter as a cutoff for diabetes, maybe it's a little bit high. And the doc looks at that and says to the patient, you just watch your diet and we'll check it next year, because they don't have that time in that 20-minute visit to address the metabolic health issues that it's very important um, to be addressed. So they kind of kick the can down the road. And I'm not incriminating primary care docs. I'm just that their reality is that they have 20 minutes. And so they very frequently don't have the time to manage that. So that's really what kind of we do in our practice. I integrate my care with the primary care docs, and we focus on the diet and exercise issues that are important to help control insulin resistance.
Okay, so yeah, let's talk about that. What are some of the things that can be done to lower your insulin resistance? If you've had the tests that you mentioned, like your fasting insulin level, how can you lower your insulin resistance?
So I'm going to back up a little bit and talk about the problem, and I
Mhm.
will answer your question, but the
Sure.
problem we have with insulin resistance. This is my belief that before the 1970s or so, we in the US ate a fairly balanced diet with a limited amount of carbohydrates. Our carbohydrate intake in the 50s and 60s was about 25% of our diet. And then we were told that eating excessive fat was the problem associated with cardiovascular disease and
Hmm.
caused a lot of cardiovascular disease. So we really did what the food pyramid and the U.S. Department of Agriculture told us to do, which is you shouldn't eat that fat. You should, basically, if you aren't eating fat, you're going to have to replace it with something else.
Yep.
So our carb intake went up almost within a decade, from 25% of all the macronutrients we take in to 50%. And remember, everything you eat is either fat, protein, or carbs. So, it's broken down that way. And what happened is our protein intake stayed about the same
Hmm.
at about 25%, but our carb intake bounced from 25% to 50%. And I think it's unmistakable that at that point, you saw the epidemics of diabetes and obesity take off in the US. If you look at the curves from the 70s until now, there's an
Hmm.
inflection point there. And actually, it's interesting because the obesity starts first and then the diabetes follows about 8 years later, which is just what you would expect.
Yeah.
And so we developed insulin resistance, getting back to answer your question.
Right. And I
And
just might
that
add in
is,
one thing, that for
yeah,
South Asians who are in the audience, that is another issue. A lot of South Asians actually eat even a higher percentage of carbs in their diet,
yeah,
sometimes as high as 80%. And they also, of course, have very high rates of insulin resistance and obesity and diabetes, which is, you know, one of the reasons that I think this can be very helpful.
Right, right, absolutely. But we did what we were told to do in terms of lowering our fat intake. And for the majority of patients that walk into my office, the cholesterol isn't the issue. Insulin resistance is the
Hmm.
issue. So let's go back and I'll answer your question.
Yeah.
So let's talk about what insulin resistance is, and then we'll talk about how it can be addressed. Um, so what happens when you eat a carbohydrate? And people have a little bit of a misconception. Everybody knows that too much sugar is bad. But a lot of people don't understand that when you eat a carbohydrate, except for the fiber in the carbohydrate, fiber passes through you and ends up in the toilet. But except for the fiber component, that carbohydrate gets immediately absorbed into your bloodstream as glucose. So basically, you eat a potato, you eat rice, it immediately is going to become blood glucose in your system. What happens when you absorb that then is that your blood glucose goes up and the organ in your abdomen called the pancreas releases insulin. And
Hmm.
that insulin really is kind of the key to allow that blood glucose into your muscles and into your organs to provide energy. So far, so good. Because, blood glucose, a limited certain amount of blood glucose in your system is good, and you need insulin. But what has happened with our increased carbohydrate intake is that blood glucose remains elevated for a long period of time. We're eating much more carbs than we did previously in the American diet, so the blood glucose stays up there. And after a while, those organs that are trying to absorb that blood glucose say we've got enough blood glucose now. They've got plenty of energy, and they start saying to the insulin, we aren't going to listen to you anymore. We're rejecting your signal.
Hmm.
And that's what insulin resistance is. It's when your organs, and I'm going to ask you to think of muscles when you think of organs, it's when your organs reject the signal from insulin. So what happens then? Well, that blood glucose is still in your blood. Something has to happen to it. And what happens to it is it goes to the liver and it gets converted to fat. And that's why people with insulin resistance end up being overweight. So it's really not excess fat that we eat that makes us overweight. It's too many carbs that gets converted to blood glucose in the liver and then gets deposited around the middle. So that's what insulin resistance is. And that's how it results in being overweight. You also heard of fatty liver disease. Blood glucose getting converted to fat in the liver causes fatty liver disease. So it's that process that we have to reverse in order for people to decrease their insulin resistance, control their blood sugars, and if needed, lose weight.
Yeah. And are there some specific things that can be done to lower your insulin resistance?
Yeah, absolutely. So what we do is we use the CGMs to assess where that is. I'm going to mention, we also do these fasting insulin levels, which are very important because you can use a formula to calculate an exact level of insulin
Mhm.
resistance in people. So that's the diagnostic phase. And then we turn to a therapeutic phase, which is for most people that have insulin resistance or are overweight, it's lowering the carbohydrates in your diet. So low carb diets are a key approach here.
Mhm.
Low carb diets, I don't believe are a fad anymore. They've been around 50 years. They've been proven to be successful. Obviously diabetics are told to limit their carb intake,
Mhm.
so people with lesser amounts of insulin resistance can benefit that as well. So the reverse happens when you lower your carb intake. That blood glucose goes down. Your
Mhm.
organs become more sensitive to the insulin that remains because your organs are not getting blasted with blood glucose and insulin constantly. So actually, those organs start looking around saying, hey, we need energy here. The blood glucose is a little bit lower because the carb intake is a little bit lower. And when that happens, the organs start looking around for another source of energy. If the blood glucose isn't persistently high, gets down into a moderate or even low range, then those organs are looking for another source of energy. And that source of energy is the fat that is deposited around the middle. So the
Yeah.
fatty acids around the middle start getting broken down as a source of energy. and that's how people lose weight. If you carry a low carb diet to an extreme level, which is a minority of my patients, that's
Mhm.
really the keto diet. And ketones are formed when fat gets broken down, and that's where that term comes from.
Now, but there are, I've always thought, some good carbs that you can have, like complex carbs, compared to, the so-called bad carbs, which are the refined carbs, so to speak. What is,
Sure.
how would you feel about the complex carbs?
So I think complex carbs, like, and we're talking really about whole grain type things.
Legumes
And
and,
absolutely,
vegetables.
yeah.
Okay.
And you can fit those into a low carb diet without difficulty. Fibrous vegetables, some fibrous fruits. So you got to be very careful with fruits these days because they're genetically engineered to have very high levels of fructose, which is a sugar in them. But yeah, you can manage your low carb diet using fibrous fruits, but you really need to avoid some of a lot of the refined grains
Mhm.
like flour or other grains that have been refined, and stick with the whole grains. And quite honestly, if you have insulin resistance or you're pre-diabetic, you're going to have to limit the amount of carbs. And I work with my patients on counting their carbs and their carb targets every day,
Yeah,
so that they can reverse that insulin resistance.
got it. Can you talk about some other lifestyle changes like timing of eating and uh, exercise and even sleep?
Sure, absolutely. So in terms of eating, there are two things that help lower insulin resistance and result in this eventual breaking down of fatty acids. And that is low carb diet that we just talked about. But another one is intermittent fasting. And I think intermittent fasting also is a great tool that people can use. And we were talking about you can't eat for 3 days. Generally, when I start my patients, I ask them to fast overnight, for maybe 12 hours or so. And then we look at gradually maybe extending that to 14 or 16 hours. I think you told me you fast
Hmm.
routinely,
Yep, I do.
correct?
Hmm.
And so that drops that blood glucose level as well and helps reverse your insulin resistance. So, you begin to integrate this low carb approach with some intermittent fasting, and it can really impact and completely reverse insulin resistance. In fact, if you're pre-diabetic, you can completely reverse your pre-diabetes. And if you're diabetic, the belief is really you can't really be cured of your diabetes, but you can put diabetes in remission so you don't require medicines for even a number of years. But the two biggest tools are low carb diets and intermittent fasting. And then there's a third tool that can be very valuable as well, and that is increasing muscle mass. So strength training.
Hmm.
And the reason strength training is important is because if you can increase your muscle mass, you can increase the sensitivity and receptivity of one of the largest organs in your body, your muscles. And so you can soak up more insulin, soak up more blood glucose, and keep those blood glucose levels lower. So the three really components of a strong program to reduce insulin resistance, help people lose weight, reverse pre-diabetes, get off medicines if you're on diabetes. It is a low carb diet, intermittent fasting, and then adding strength training to that as well.
Okay, excellent. And I can tell you from personal experience, I found that making sure you get a good night's sleep actually does have a direct impact on your insulin, your glucose levels. It actually may run a little bit higher if you're more sleep deprived, say if you've undergone some jet lag or for whatever reason, including taking call and you didn't, whatever reason you didn't get a good night's sleep. Um, okay, and
And the reason for that is cortisol levels. If you aren't
yeah,
sleeping well, your cortisol levels rise, and cortisol levels cause basically your blood sugar to rise. It has organs release blood glucose into your system. So yeah, maintaining a good cortisol level, sleep, and then trying to decrease stress, which we're all trying to do,
yeah,
right?
and stress is a big factor too. Um,
Yeah.
So there have not been any actual research studies that show that glucose monitors can promote weight loss yet, but what has been your experience?
So, historically, the use for non-diabetics is a newer use. But I network with a lot of the national leaders in metabolic health across the country, and we all use these routinely because they help guide diet. Basically, the phrase that we use sometimes is when people eat, let's say a refined carbohydrate and they see their blood sugar spike. The phrase that we use is you can't unsee that. You
Yeah.
know what that is doing. You've
Oh, of
experienced
course.
it,
It's
right?
it's it's great
Yeah.
feedback to know. Look, you don't want to stray when you're seeing something like that happen to your body.
Right. So then you use the CGMs on an ongoing basis to guide a low carb diet. And I don't think there's any better tool to help patients reduce insulin resistance or reverse insulin resistance and to lose weight.
Yeah.
Because you have this device on your arm 24/7 and you know that you know what you can eat to achieve the pattern you want. And for a few of my patients, they also know that I can monitor those numbers remotely. So I can literally follow their numbers almost in real time.
Yep.
I don't do that, and I don't intervene unless I see somebody's going off the rails for 3 or 4 days at a time. But I, periodically see what their glucose curves and their glucose numbers look like. And then when we have our monthly discussion, then we talk about, what happened on this day or what happened on that day. And for some people, that accountability is very valuable.
And the other thing I might add from these applicable particularly for South Asians, people of South Asian origin, is even if you're young and otherwise healthy, there's been studies that have shown that um, even young and healthy South Asians may have some level of natural insulin resistance. In fact, compared to white Caucasians of European origin, in a study I saw, there was more than double the level of fasting insulin levels, uh,
Right.
which
Yeah,
was quite a surprise for me to see that for the same level of glucose, for a normal glucose level, the
right.
fasting insulin level was more than double. Um,
Right.
and is there anything else that you would like to talk about, Paul, that could be?
No, other than I think what you just mentioned, which is awareness needs to be raised related to the issue associated with insulin resistance. We're so educated now to focus on cholesterol levels, when really high blood sugars are as much or even more of a problem for many people. And the mechanism here, just we didn't talk about the pathophysiology, but when you have high blood sugar levels, those blood sugar molecules are attaching to the lining of
Mhm.
your blood vessels and causing inflammation. And that's why people, diabetics, but people with just high blood glucose, end up having vascular problems, peripheral vascular disease,
Yeah.
kidney failure, eventual strokes. And so to get out in front of it and find out if you have insulin resistance early on, especially in the population you're talking about, I think is critical because again, the healthcare system isn't set up to detect this early and intervene early. So you got to be aware of your potential risks, and I think really take your health future into your own hands by seeking out help. And again, I have a private practice in the Dayton area where we help a lot of patients. But really, no matter who you work with, you got to push this issue because again, the healthcare system's maybe not going to help you a lot with this. You got to advocate for yourself.
Great advice, Paul. Well, I guess we'll conclude here, and I really appreciate your time and thank you for coming on this interview. Paul, great having you. And once again, this is Dr. Paul Kolodzik. And this is Mubin Syed, your Daisy Doc, and we'll be finishing the interview now. Thank you.
Thank you very much.
Yep. Appreciate it, Paul. Thank you so much.
All right. I hope that was what you were looking for.
Yeah, no, this is great. Excellent. I really appreciate that.
Okay. Hey, if you wouldn't mind, I'll send you a link to the book, and I don't know if you can you post that when you post
Yeah, yeah,
the
definitely. Sure, sure.
okay. So
Yep.
I'll go ahead and send you that. Well, good. Yeah, how are you doing? Good.
Doing well, doing well. Yep.
Okay.
Yeah, I appreciate you're doing this, and I think you did a great job of presenting us. I'm just going to end the recording here 1 second.